Well, there's a new website available if you have more questions about the coronavirus.
COVID-19 Wisconsin Connect is a new resource with information compiled by local experts and researchers. Earlier today, we spoke with Mike Wagner, UW journalism professor and the co-creator of the website.
It's all about three basic things. First, providing a way for folks to engage in discussion with each other about what they're going through in terms of how they're handling the pandemic, and also to ask questions of our moderators regarding, strategies they might undergo or whether things they might have heard on the internet are true. The second is an actual fact checker, which provides updates to claims that are being made around the Wisconsin information ecology and whether they're true or not. And then the third is a Healthy Minds Innovations feature where people can get tips to reduce anxiety, reduce stress, meditate, all in one place. So COVID-19 Wisconsin Connect is kind of a Swiss Army knife, one-stop shop for discussion, fact-checking, and anxiety reduction.
Oh, that's wonderful. What kind of information can people expect to find on the app and the website?
Right, so they can find information vetted by our state's Department of Health Service, our state's DHS, to, think about when do you need to call a doctor, what sorts of symptoms should you call a doctor when you have. They can find resources about facts that are true and that aren't, and they can find resources on how to help their own mental health as they're, navigating, staying home with kids, homeschooling kids, trying to work, or maybe have been furloughed from work, or trying to keep connected with grandparents, and all of those things at once is a lot to manage. And so part of what the site does is help people develop skills to handle that sort of thing.
Who's developing the content for all this?
So it's a partnership between DHS has helped with some of the medical side. The College of Engineering's Center for Health Enhancement System Studies, or CHESS, is really the place that has the tried and true how to build an app and make it good for health communication architecture. And then our department in the School of Journalism and Mass Communications helping on the fact-checking side, and the Healthy Minds Innovations folks are also helping with the stress reduction, anxiety. So there's a bunch of different departments contributing their expertise all in one place that's free for the people of Wisconsin.
And is this something that's available today?
Yep, you can go to COVID-19WisconsinConnect.org, and the website is up and running. Discussion rooms are up, the fact-checking's up. You can look at the meditation guidelines as well. And then the apps through the App Store or through Google Play have been approved by those organizations. They're working their way through the bureaucracy and should be available this week.
So somewhere down the road, but very soon.
Very soon, yeah.
Is there a component where people can contribute their information to the app and the website as well?
Yeah, so we have a discussion room feature where there's one place people can talk about parenting and grandparenting in the pandemic, one where they can talk about testing and quarantining, and one that's more of a general life in the pandemic section. And there people can express their own ideas, ask their own questions, engage with others, and have real conversations, because part of the problem is just we're all isolated right now. And so to have other people to talk to in the state that are going through the same thing is something we wanted to provide an outlet for with the app and the website.
Information and facts are so important at this time, and this seems to supply it all. Michael, thanks for being with us today.
It's my pleasure.
All right, stay well.
Great to see you. Thank you so much. Let's take another look at that. It's COVID-19 WisconsinConnect.org, and it will be coming to the App Store very soon. And Mike was saying this is going to be a nice complement. They're not doing the news. Right. In other words, the facts and the figures, that's sort of our job. Right. But this is going to be so much great information to kind of supplement how we're all getting through this right now.
I called up the website this afternoon, and it's very informative.